Hey guys, it's Nurse Gwenny. I got a DM from a follower recently and they said I'm still pretty new in my role and I don't know how to trust myself that I'm making a good decision with what's going on with my patients. And guys, that's totally valid. If you didn't feel like that when you were a new beginner, then I just can't identify with that, because I for sure felt like that. And even still a decade into this, sometimes I still worry, am I making the right decision? There's something called clinical Gestalt, and it just means that you are putting together all the historical pieces of information that you have gathered, a whole bunch of years and years worth of analytical data from taking care of your patient. Maybe anecdotal data is a better way to describe it. And sometimes when I see something going wrong with a patient and it turns out that I'm right, and someone says, wow, how did you know that? And I jokingly say, well, I'm like Nationwide Insurance. I know a thing or two because I've seen a thing or two. But it really is true. There's an element of this that no matter how book smart you are or how many case studies you've read, there's something about years of experience that helps you to predict what's coming up with your patients next. So how can you learn to get there? Number one, part of it's just experience. Number two, it's listening to other people who have experience. I fly with a couple of phenomenal nurses and paramedics that have been at this for 20 or more years. And when they speak, I listen, because they have more experience than I'll have probably my whole career. And so it's imperative that we listen to others who went before us, watch them carefully, watch how they work, and adopt some of their healthy habits. So I hope that helps you guys. Believe in yourselves and just keep working at it. And I promise someday you'll look back and say, I finally got good at this.